Well, the Omicron surge is starting to die down a bit, but local hospitals are still trying to rebound from the onslaught of patients. Now, doctors are seeing a rise in blood clots in patients suffering with COVID. And where you land during an emergency like this really matters, as one woman found out when her life was on the line. At the end of 2021, Christina Peak, a nurse, was not working. 3 months pregnant, she found herself short of breath and feeling like she was running on a treadmill when she was only sitting.
I said, my heart shouldn't be beating that fast.
Without health insurance and afraid of a big bill, she stayed home, hoping she would feel better. But instead, she fainted.
I said, you gotta call 911. She's like, what's wrong? And I was like, something is not right.
After passing out 2 more times, paramedics arrived. Her oxygen level and heart rate low. She had pulmonary embolisms in both lungs and at risk of death.
I remember my niece, hit me like, TT, wake up, it's gonna be okay.
They raced her to Ascension Macomb, where Dr. Theodore Schreiber says they have pioneered brand new technology to deal with blood clots on the lungs.
How major of a case was hers?
It was a very major case.
Ascension Macomb has a PERT team, which stands for Pulmonary Embolism Response Team. Even with an overload of COVID patients, their emergency room knows what to do when a patient has a clot.
Without a PERT team, and had she not arrived to you, would she have died?
If she landed at another hospital without a PERT team and the technology and experience that we had at Ascension Macomb, she would have died, yes, ma'am.
Knowing she was pregnant, doctors told her they had to save her first, and time was critical. They first did the least invasive procedure to break up the clots by going through her groin.
It felt as if an elephant was on my chest. I couldn't breathe. It was horrible.
They quickly realized it did not work, and she had to be rushed back to the operating room. An entire team of doctors surround her.
I just remember throwing my hand in the air and just said, I quit. I said, God, just, this is my time.
Then
I could actually feel that last blood clot. One of the physicians was pulled out, and I'm like, oh my God, I can breathe.
Dr. Schreiber says before clot retriever technology, a patient like Christina would have needed open heart surgery to remove her pulmonary embolisms.
It's the only easily available technology that's easily usable and safe to remove most, if not all, of the lung clots.
Dr. Schreiber says since the pandemic began, the number of lung clots in patients doubled, tripled, and quadrupled. Risk factors include your weight, whether you exercise, heart disease, diabetes, and if you're elderly. But the most major risk factor now is the presence of COVID.
Did you realize how lucky you were going to a hospital with a PERT team?
I would definitely have to say, due to that was nothing but God, and they went to the closest hospital.
Dr. Schreiber says if you have any symptoms of a pulmonary embolism, including fainting or leg clots, which can cause swelling, pain in your calves, or new discoloration, please seek medical attention immediately. And boy, oh boy, was she lucky, Dave.
I'll say.